Yes, very good morning, dear medicos. We are having the honor to have Dr. Sabyasachi with us, rank 89 INICET examination. So, beta, first of all, on the behalf of DAMS family, we congratulate you for such a great achievement. Beta.
Thank you, sir. Thank you, sir. It's all due to DAMS, sir.
All due to DAMS. So let us plan a strategy, beta. I want this platform, we will be using this platform to just discuss how you proceed, in the last 2-3 years. You were our DAMS Bhubaneswar student, 2-year foundation student, followed by you have joined T&D in DAMS Hyderabad. So, but at this journey of last 3 years in MBBS, along with your DAMS, how it was a game changer, beta. Let us start from starting from the first day. What was your strategy in the first year, second year in a medical college?
To be frank, to be the first one in the family to join MBBS, I had no idea how to go. So first year, it's all went by regularly, like bunking anatomy class, physiology class. That's first 6 months everyone used to do.
You have to
then after that, we came to know that it's important to study. So then gradually, I continue study, but it's first year and second year means people are not that used to study rigorously because they have just cleared the entrance and got into medical college. So that's why it's don't take too stress in the first year and second year. Just go regularly. And once you become third year, then you can start studying for the entrance examination because first and second year are just adapting the environment and enjoying. And once you reach the third year, then you can continue for PG preparations.
So, but the first year, second year, agreed every medico, even 25 years back when we were in the first year, it was difficult to concentrate and difficult to study. Honestly, we are adapting to the medical college. Like once you enter in the third year, and now we are getting the rank 89. So from third year to this success of rank 89 INICET 2022, what was the importance of basic sciences in this success journey, like anatomy, physiopatho, micropharma?
The basic sciences like INICET mainly focuses on basic sciences. First year, second year too much because in this recent INICET paper also medicine question are only 5 to 6. So most of the medicine question can be solved by pathology and pharma knowledge. So that's why first and second year are very essential. But most of the students, as they don't focus in first year and second year, so during third year they should try to somehow not every day is not possible. So every week they somehow try to study first and second year subject piece by piece. And at the end of third year, before joining internship, you should at least read. If you can complete only first year subject, that's also good. And during internship, you should focus mainly on the remaining first and second year subject.
It's great. We are proud to share Dr. Sabyasachi with us, rank 89 INICET examination. What I'm getting from the first discussion, even if you cannot study basic sciences in the first year, second year, you should focus more in the third year, at least once in a week. You should focus on these basic sciences because in the final year, you will not be getting that time. That's it. So, but in the third year, when you joined DAMS Bhubaneswar, how was the experience like? How you used to manage all the live classes?
So the live classes used to happen mostly on the weekends. So Saturday, Sunday, and 2-day or 3-day class maximum. So we used to go to DAMS. Compared to online classes, offline classes are good because if you take subject and medicine, surgery is very vast, and to complete in online video, it's definitely not possible because you will watch the phone and will keep it there. As you are not feeling good today, but if you do offline classes, then you have to stay there, but 12 hours, 3 days, surgery will be completed. That's the most advantage thing.
The discipline which you followed, what I'm getting from your word, like we have to complete this topic in 3 days, means rule of the game, we have to complete. If you postpone, it will be at the cost of your failure. Agreed, absolutely. The best part of the offline lectures, we are following the discipline. So, beta, when you were coming in the lectures in third year, DAMS Bhubaneswar, like how was the understanding there? If I compare, like you're sitting at your room and you're attending the lecture, one you are attending the interactive lecture in the classroom, where was the difference which played important role in rank 89 INICET?
Mostly by teaching in between classes, the teacher used to tell that some motivational story also. So that's also keep boosting the student to study hard, and in between classes also. And our college in Tunisia, some top rankers, rank 1-6, also used to come to DAMS classes also to motivate student. That's also further pushes student to study even hard.
In the third year, when you were attending all the phase 2 interactive lectures, following the discipline, it was not an easy game for you. You were having your college classes, you have to self-study, then you were attending your DAMS lecture, and because of which you are getting this rank 89. So, Beta, what was the importance of self-written class notes? The notes which you have written first time when you were attending DAMS classes, Beta?
So the notes you have to read that because it's very hard to read, because you have to simultaneously listen to the teacher and write. So it's sometimes it become difficult, but you have to after 1 to 2 class you are adjusted to it. So after that you have to write your own note, because main thing is revision, and during the last 10 days of any exam you have to completely revise the 19 subject, 19 or 20 subject, because COVID is also becoming a subject. So 20 subject, you have to revise. So for 20 subject, ENT is also a big thing, because if you see ENT, it says 60-70 pages, you think I'll complete in 5 hours. But during last 10 days, you have only remaining 2 hours for completing ENT. So that's why if you have written your own handwritten notes, that's the main advantage, that you know what is important, what is not important. Because by giving JTs, you must have known that this topic is important, this topic is not asking regularly. So, but main thing is revision. How much note you make, that does not make a difference. So during the last 10 days, if you are able to revise subject in 2 to 3 hours, then that's the main point. So you should always try to maintain the handwritten notes.
So what I'm getting from you, the 3 steps of the success. First step was you were writing your own notes. Next, you were concising the same notes, because you have to revise ENT in 2 hours in the last 10 days. Absolutely, like this we have to understand. Every medico sitting across the country, you should learn this point. In the last spell, in the last 2 weeks or 1 week, we have to complete a short subject like ENT in 2 hours. And how it will be possible? When we have written the class notes, followed by we concise the notes, and then we should have, like, say, 20 pages of ENT which we have to revise again and again. Whatever DAMS people say, mind mapping of all these subjects. And what was the role? Like in the third year, you were writing all the notes, and every faculty motivate you to concise the notes. And what everybody is saying, you have to draw the mind map of the whole topic. What was that strategy play the important role? So how that strategy play the important role, Beta?
By seeing the last 2 papers, they're asking more clinical stuff. So they will ask the some anatomy image and related to the medicine question. So more is about clinical type. So by mind mapping, you can relate that this pharma question will be asked in medicine, this pathology question will be helpful in surgery, and that's like that. And anatomy will help in ortho. So
very true, Beta. Now, coming on the next third year, you have written all the class notes, and in the third year, you only focus, like what I'm getting from your words, you have done the homework of first year, second year in the third year, and you have prepared for ENT Opthal PSM. So when you joined the DAMS first time, how was the experience of ENT PSM Opthal in prof examination? Because you were taking 2 efforts, one college, one DAMS classes. So what was the role like? Did you face any difficulty in the prof, or prof examination was a cakewalk for you, Beta?
So to be frank, sir, Optha, ENT, and PSM I read only from the DAMS copy for the prof. Because in AIMS, everything surgery, ENT, Optha, everything comes in one paper. So it's very hard to read in one night to complete each subject. So by reading the notes only, you can complete. So it was very helpful. So the DAMS copies played an important role in passing the profs.
So in the final year, whenever there was a big stress of medicine surgery, did these DAMS class notes played the role, or you have to refer to the other textbooks?
So mostly DAMS copies, but some important 10-mark question that somehow you have to refer, but mostly DAMS copies, because it's such vast subject that you cannot complete. However, whichever short books you are referring to, you cannot complete. So mostly DAMS notes, and some other books.
That's great. We are proud to share the success journey of a DAM student ranked 89 on this platform. And I wish all the medicals listening to him should get motivation. Okay, how he secured this rank with hard efforts, 2 years foundation course with the TND. So how was the experience of test and discussion at Hyderabad, Beta? When you joined what was your strategy? Like you were having all the class notes with you? Like say your first TND is of surgery. So what was your approach? Like how you prepare for that surgery TND, Beta?
Mostly before approaching any PND, I tell the students that first do the previous year topics. Previous year question of surgery of last 5 years you should do, and note that whichever topic is important and mark it down in the copy. And then after first try reading those subjects, and then first during PND most each subject gets 1 week time, and 1 week is sufficient to cover any subject. So before starting any, but if you try reading surgery, it will also take 15 days to complete. But it is not possible to read surgery for 15 days. So you should first try the previous topics, whichever they are asking, because the peculiar habit of AIMS is that AIMS repeated its topics very much. So you should know that whichever important topic is there and whichever might be asked, because in TND, TND discussion, they tell that this is important topic, this might be asked in the next session.
That's very true, Beta. Like it's not possible to complete each and everything in the 7 days before TND. So better to restrict yourself to the classroom. How was the quality of MCQs? Like I am asking on the difficulty level, like difficulty level of TND against difficulty level of last INICET, which was a difficult paper.
Yes. The TND paper was also difficult. So during in the last TND also, this ENT also, which you put the paper, that was also too difficult. But main thing is that you should realize that 20 to 25 question of INICET are also unbearable. Whatever, whichever topic you read, how many number of hours you study, you cannot do the 20 to 25 question. It's totally unbearable. So it's better that you should restrict yourself to time, and that 20 to 25 question you should apply your casework.
Very true, Beta. And what was the importance of like gold standard class notes, the concepts which you learn in the class notes, you have written the class notes, how they played the role in this success, Beta?
Class notes are very essential because it's also helps for the prop, and during the entrance, its help is immense. And so you can describe how helpful is the class note, because if one class note is lost, then you are completely also lost. So try to preserve your class note as much as possible and read it thoroughly, because it's MBBS is not possible, but during intensive you can try class notes. Class note during after the class every week, just try to read it once. During intensive, then you read the remaining.
So, Beta, after attending the lectures, after attending TND, when in the last spell you attended our DVT, what was the role of DAMS result rate, and how was the experience of those 5-7 days, Beta?
So DVT was awesome, sir, because short subject like radio, mostly they ask images and you can complete it within half an hour, because last 10 days if you have not studied radio also, you can watch the DVT video, you can complete it within half an hour. That's the beauty of DVT, and it's many images are asked directly from the DVT also in INICET. That also helps a lot.
Great. And then, Beta, coming on the question bank, like grand test, SWT, how you rate the difficulty level of GTs and SWT against difficulty level of your INICET examination?
Sir, the recent DAMS clinical grand tests are very much awesome, because the question pattern has increased dramatically, because they're so conceptual that it's difficult to do. So, so you should give GTs regularly, and SWT is also during the last 2 months of preparation, start doing SWT, because it's whatever topics you are missing, that can be covered through SWT. And GT are essential because GT plays a backbone of the preparation, but don't take it too hard that I am not scoring well, that I should not score well in INICET. That's the main thing. And GT, you should try giving as much as possible. There is no limit.
Our score should improve day by day. Like in the last grand test, my score was 40. My next grand test, it should be more than 40. This rule should be there. So, beta, how was the experience of CBT, like coming on the last platform of CBT? How, when you appeared for the CBT examination, how that experience played the role in your success journey?
So CBT plays an important role as that during 3 hours of main exam, if you have read everything also, that can go bad. So you have to adjust it with the environment of the exam, because its environment examination is little stressful. So you should go to the center and give the exam. And during the main exam, it reduces the anxiety.
Again, we congrats our DAMS proud student for securing rank 89 in INICET examination, and we are using this platform to just share the success story of the student so that everybody should get a motivation. And beta, honestly, your success, your words motivate everyone, including we people are motivated via our efforts. You proved our efforts, beta. Thanks a lot, first of all, for proving our effort, getting such an awesome rank. Now, beta, I just want a student who is preparing for next INICET. I will ask you 2-3 questions which you should reply very honestly. Like the student are going for next INICET, what should be the first line of batsman? Which subject should be given the most preference?
The first, second year subject and first year, second year subject, you should do thorough.
First
preference.
preference
Means everything, and if you can't do any subject, then if you cannot study a subject, try at least doing the 5-year previous year question, because the AIMS habit is they ask the ditto copy of the previous year question. They don't even change the option. So if you know the answer is B, the answer will be written B. Whatever the question is, the AIMS don't also change the option. So that's the big advantage you can have by doing the previous year question. And by doing the previous year question, it reduces the time, because during this INICET, the gynae question are too long. Means it can be doable, but the main time is for one question you need 5 minutes. And by doing previous year question, which will appear in exam, by 20 questions it will take maximum 5 minutes to do the 20 questions, because you have already known the answer. So by the remaining 15 minutes, you can take for the OBG question which are too long.
That's very true. So basic sciences followed by you should read the last 4 to 5 years question bank. Along with that, beta, like all these students who are preparing for next NEET examination. So what special advice you will be giving to those students for the last 2-3 days?
Don't take too stress, because I know I have also performed badly during the last NEET due to anxiety. So don't take stress, and please sleep 6 hours before the exam, because exam it can go well if you sleep well. And try to read as fast as possible during these 3 days.
Thanks, beta. Thanks a lot. We wish you, your family, your parents, because of whom you are on this platform today, beta. So convey our wishes to them. Best wishes for your future, beta. And thanks a lot for coming and sharing your success story, beta. Again, we congratulate you.
Thank you.
Thank you, beta.
Thank you. Thank you. Thank you.